Makkah and Ramadan Mubarak to you all. Please welcome to third and final COVID-19 Partnership Conference. My name is Noor Aidi. I am third Somaliland Country Director. I'm facilitating the session of this morning, and the theme of the conference is Transforming Pathway for Healthy Recovery, Learning Our Mistakes. A number of speakers today will be highlighting how our global community will not waste more time in ensuring we are building healthier future for all. Number of speakers highlighted already, but Hargeisa Group Hospital team will tell us stories and challenges they have faced for the last 2 years and a half of responding to COVID-19. To anchor the conference in an understanding of the challenges faced by healthcare workers. Therefore, the team will highlight those challenges faced by Hargeisa Group Hospital during COVID-19 period. We have 3 speakers today from Hargeisa Group Hospital, expert team. Hargeisa Group Hospital is the largest national referral hospital for Somaliland, supporting 1 million population in Hargeisa and receive referrals from other regional hospitals. The first speaker is Dr. Mustafa, who is one of the Hargeisa Group Hospital managers. The second speaker is Dr. Abdi Shakur, who is a medical doctor, have been managing and treating COVID-19 patients for the last 2 years and a half. And Mahmoud, who is a nurse in charge. And we know that nurses have contributed during the pandemic a lot, so they have received a lot of challenges. So we will hear from them the challenges that they have faced for the last 2 years and a half. So my first question is to Dr. Mustafa. So Dr. Mustafa, how have the past 2 years have been for you as a manager of Hargeisa Group Hospital, and especially as you were also responsible for healthcare workers in Hargeisa Group Hospital, how have been for the last 2 years and a half? Thank you.
Thank you very much, Nora. The past 2 years was very difficult, extremely stressful, and also challenging to both health workers, management team, and also to the public in general. So it was March 2019 when the first case of COVID-19 was detected in Somaliland in general, particularly in Hargeisa. At that time, there was no PCR machine in Hargeisa Group Hospital, so we were not able to detect COVID-19 cases. Also, the staff were not having trainings particular to that disease. And the disease itself was something new to the world, and the world was learning every day COVID-19. The other challenge at that time was the oxygen plant of Hargeisa Group Hospital was not functioning at that time. So when the first case was diagnosed, the government of Somaliland has established national anti-COVID-19 committee led by the Vice President to mobilize the resources and also to give instructions to the general public how to fight COVID-19 cases. So in Hargeisa Group Hospital, we have established structures to fight against the COVID-19 cases, to share information with the different departments of Hargeisa Group Hospital, and also to mobilize the limited resources that we have to fight against the COVID-19 disease. So we have prioritized our strategy. First, we have succeeded in partnership with the UN and other INGOs to get and receive PCR machine in Hargeisa Group Hospital. and also to get training, on-job training to the staff. Also, we have established triage system in order to sort out patients. So you can imagine, as you have already highlighted, Hargeisa Group Hospital is the national referral hospital. Also, it serves around 1 million people who live in Hargeisa. And it was the only hospital in Hargeisa that has PCR machine and that has the capacity to receive and treat COVID-19 cases. So in a summary, that 2 years was, very tough 2 years.
Yeah, thank you very much, Dr. Mustafa. You have highlighted a lot of challenges, including, challenging and no having PCR machine at the beginning of the COVID-19. The oxygen planter was not working, so I think you faced a lot of challenges. Can you mention a number of challenges that Hargeisa Group Hospital healthcare workers faced during the COVID-19?
Yeah, healthcare workers in general, particularly those who are frontline healthcare workers who were receiving COVID-19 cases, was receiving multiple challenges. To mention, there was no adequate PPE for the staff. So it was a big challenge. The other challenge was training. For example, we have mobilized the staff who were working in different departments, for example, surgery, medicine, internal medicine, obstetrics, something like that, to counter COVID-19 cases. Some of them are not familiar with respiratory diseases. So it was, also a challenge to get them updated, to provide them, adequate training, and also, resources and information about COVID-19 cases. The other challenge that the health professionals were facing was they were working long hours. So they were, liable to tiredness and also mental health and psychological problems because they were seeing and encountering a lot of patients who some of them are their relatives dying, suffering in front of them.
Yeah, thank you very much. I can understand how those issues was challenging to Hargeisa Group Hospital management. And thank you very much for sharing those challenges. Can I now ask the same question to Dr. Abdishakur, who have been managing COVID-19 cases for the last 2 years and a half. Dr. Abdishakur, how have the past 2 years have been for you as a medical doctor?
Okay, thank you very much, everyone. Can I hear it normally? It's okay?
We can hear you well. Thank you.
Okay, my name is Dr. Abdishakur, and I was last 2 years an COVID medical doctor. Firstly, I am working in emergency department before the pandemic declaration in the worldwide. At that time, the situation is normal before the pandemic COVID, an emergency situation. After pandemic declaration, there are some patients have problem for the respiratory and have fever and comes to the hospital every day, and every other day will be increasing. After that, no one can realize that the COVID, this condition, unless the confinement first case of Somaliland and Minister of Health. After that, when the patient is to the hospital, most of them have feeling stigmata. If you ask the question about to diagnose the COVID-19, some historical and some information they miss it because they have feeling like stigmata and they're calling that patient as COVID-19. After that, when the pandemic, the number of the patients is increasing, the situation of the emergency immediately they change. They have more fearing from the patients and the staffs, nursing and doctors, because situation every day will increase it. The number of the patients will come into the hospital. Most of the doctors they don't have any experience in management of outbreak like this condition. The number of the patients will come into the hospital. They have critical patients. Most of the patients that come into the when they develop respiratory failure. We don't have any machines like ventilators. We don't have any other machines that aid the oxygen. Only we have oxygen machines, cylinders. Sometimes we have only nebulizers. That we not enough to manage the patient. Then we decided to make separate wards. We have allocated the rooms that only admitting to the patients of the hospital, the COVID-19. Then the emergency will change the triage of the any patient have respiratory problem to the coming to the pharmacy. Then the patient will manage and then they classify the grade and the severity of the condition. Then we have started to the new wards and to building almost 100 beds. The patient is increasing. The situation is very hard. The nursing with enough experience. The doctor is the same. We manage every change. Every time we'll change it because if they don't have articles that the worldwide using. Every doctor is managed his own experience. The tuition is will increase and the patient will start to the dying because if the patient become respiratory failure, we don't have any supporting machines like ventilators. We don't have any experiences. We don't have any knowledge to manage this patient. We don't have any ICU. The situation is very increasing. Some patients we call in their homes. They ask the supporting, and we ask him if the patient is a mild case. We encourage to the stay in the home and the quarantine. If have the symptoms, the severe symptoms, comes to the hospitals. When the Minister of Health will start the call center, the calling the patients in the home. Sometimes the patients have coming to the hospital their home, their own cars. Sometimes the Minister of Health will send it to the ambulances. The situation will increase. I define it that the past 2 years is very sad because we have lost most of the families members like mothers and fathers. That is the really it was very tight because we that was the first time the outbreak management like this condition is so hard. The situation was so bad.
Thank you very much, Dr. Abdishakur. I can understand having challenges with no ventilators and people with respiratory arrests you were managing was so shocking and so stressful to you and the other doctors at Hargeisa Group Hospital. Thank you very much. And I know we lost most of our relatives. Some of us lost their families. So that was a very serious situation for the last 2 years to us all. So thank you very much. So can I ask the same question to Mahmoud as a nurse supporting pandemic at Hargeisa Group Hospital? How have the past 2 years been for the nurses at Hargeisa Group Hospital?
My name is Hamoud. I work in Hargeisa Group Hospital as a nurse. Are you hearing well?
Yes.
In the past 2 years, very tough because of the work is doubled. Because of the more patients coming in the ward, because all the patients is a critical case, and in more we have the patients we have close monitoring. The patients have diabetic, commonly diabetic and hypertension. When the patient is coming age is offered by commonly age is offered by 50 because of a critical case, and monitoring is for life very tough. Last 2 years, the COVID affect me before that coming in the vaccination. I was myself, and the past 2 years life very tough. And I have no comment.
How did the nurses feel for the last 2 years supporting patients?
The feeling is the nurses are feeling wallahi is not good because of
They were working long hours.
long hours and sometimes shortage of supplies. Lack of
Absolutely.
sometimes lack of mask, lack of PPE, emotionally, very, very, very tough last 2 years.
Thank you very much, Mahmoud. We know that nurses were dramatically supporting the COVID-19, and they were most of the time near to the patient. And without having the PPE was also another challenge. And I remember sometimes we have realized that majority of Hargeisa Group Hospital staff were contracted by the coronavirus. And that was a challenging to Hargeisa Group Hospital to respond to the situation. So thank you very much.
Okay.
I'm now going back to Dr. Mustafa. So Dr. Mustafa, how has COVID-19 impacted patient and wider community in Somaliland, and specifically those people in Hargeisa?
Yeah, and for patients, the morbidity of the patients was too high. So a lot of people, mainly the elderly people, have contracted COVID-19, and some of them have died. So also the mortality was very high among elderly, people. Also in wider population, it has affected the utilization of hospitals. So, a lot of people who were having the diseases afraid of going to hospitals or health facilities. They were afraid of contracting COVID-19 if they go to the hospitals or MCN and health facilities. That has caused a lot of complication to them. And also those who are having elective surgery or elective procedures, they were unable to be done. First, overload of the health system, and secondly, the people were afraid of going to. And also, it has affected it has caused, there was a lot of restrictions in the movement of the people. So the people were ordered to not move. That has affected them. Also, that has affected them economically, because most of the people, they go early in the morning into the market, and they get their work there. Also, it was having a lot of psychological and mental health issues because of the phobia and the environment that COVID-19 has created. So over to you.
Yeah, thank you very much. I think that was also challenging as patients were not attending to the hospital to receive healthcare services, and especially for women who are supposed to have cesarean section at Hargeisa Group Hospital, but they don't want to come as they're afraid they will contract the coronavirus. That was really a challenging to you and to Somaliland population as well. Thank you so much. Dr. Abdishakur, from your perspective, how has COVID-19 impacted patients at Hargeisa Group Hospital and as a wider community in Somaliland?
Okay, thank you very much. I am explaining in the two ways. In generally, the population of Somaliland living in Hargeisa, in general, they lost their economic condition. And my patients and our patients, they have psychological impact. I was remember most of the patients when admitted to the hospital, most of their age average more than 55 years of age. When they admitted to the hospital, they develop early stage for the mental disorder like delirium. They have some agitation, sometimes confusion. Most of the relatives, they say this is not medical disorder, this is traditional disease. After that, when they are admitted to the hospital, when the recovery, some patients is when the discharged to the hospital, some patients they develop what is called PTSD, post-traumatic stress disorder, because they have some good friends, patients have and some relative they lost mom when survive when coming to the hospital. They ask, where is my friend? Where is my another family? The relative they tell him that they lost and they died. And some patients they had developed post-traumatic disorder. Some the young man and the younger people they have COVID recovery. They develop anxiety disorder. Everything they worrying, they come to the hospital and they call it the telephone. You say you have feeling some like anxiety. They have heart beating increasing, and some people they have coming to the hospital anytime. He's feeling like difficult breathing, and the other people like pregnant women when they recovery to the hospital, then they develop the depression because they have more challenges. In conclusion, most of psychological impact in the patients. In other and other people that living in Somaliland, they lost their economic because the economic crisis. They lost their work daily activity. But most of the patients they have developed psychological impact. It's not too much number, but some people they have developed like anxiety disorder, post-traumatic stress disorder, and sometimes like depression that impacted the COVID-19. The patients have psychological impact.
Yeah, thank you very much for elaborating more how COVID-19 has impacted to the patient as well as community, including those post-traumatic disorders as well as economic issues that we have all facing. So thank you so much. So now I'm going back to Dr. Mustafa. So Dr. Mustafa, what have your international links looked like and how important have those been? I know that has been funding to King's College in London to support you with a number of projects. Do you think those were important?
Yes. You know, international links at that critical moment was key and was very crucial to counter and fight against COVID-19 cases. So thanks to that King's partnership, they were one of the INGOs that has responded early. So they have provided Hargeisa Group Hospital when the crisis has started. They have helped us to establish a triage and triage protocol with Hargeisa Group Hospital. So that triage protocol and triage establishment was key to our successfulness to counter COVID-19, because more cases were coming to Hargeisa Group Hospital. Everybody who is in Hargeisa who developed symptoms of COVID-19 was directly coming to Hargeisa Group Hospital. So to sort out that cases was very crucial. So and in partnership with that, we have established that triage, and also we have developed that criteria: who should be admitted, who shouldn't be admitted, and should go to the home, and should stay, in isolation in homes, and should contact that numbers if they develop, just that kind of symptoms. That was very crucial. Also, King's partnership has provided Hargeisa Group Hospital, any kind of technical instructions that we have needed from them. Also, they have provided us IPC, infection prevention and control project. That project was very, successful. As you know, COVID-19 was very infectious disease. So it was very important that the staff and the hospital should have IPC guidelines and should have, IPC tools that is necessary to implement IPC guidelines. So they have hired a consultant for Hargeisa Group Hospital. That consultant has prepared guidelines for how to manage medical wastes and infection and something like that. And also we have trained most of the medical staff on IPC. And also there was buckets and other tools that needed to counter. And also I would like to mention World Health Organization. which was a very, important partner when it comes to combating and fighting against COVID-19 disease. First, they have provided us PCR machines, which was very critical and crucial. Also, they have trained the staff of about case management issues. So, over to you.
Yeah, thank you very much, Dr. Mustafa. I think WHO and was very important providing those technical support to Hargeisa Group Hospital as well. And I remember when COVID-19 has started, we were establishing a platform where doctors of Somaliland, especially Hargeisa Group Hospital, were consulting with UK doctors how they can manage cases when the COVID-19 has started. So I think working together is very, very important, and we are learning from each other as well. So that was really important. So I'm now going back to Dr. Abdishakur. Dr. Abdishakur, do you think that those international links was important to Hargeisa Group Hospital? Abdishakur, can you hear us?
Yes, sorry, I've muted. Okay, that's more important because when starting the management of the case management of COVID-19, whereas it was very difficult because there is no really past disease or now in the disease, they really have articles or another guidelines management. This is the new, the patient is dying, it's not having a time. That's more shocked because if you search into the Google or internet, there are a lot of guidelines in here. After that, WHO, Minister of Health and King's College, and that we have facilitated to have a lot of training, repeated training to improve in either IBC or case management. Especially in WHO and Minister of Health, we have facilitated to get the guidelines to manage the patient. And also some guidelines we develop clinical practice day of the day, because when the patient comes to the hospital, you don't have a time. When you start the medication applicable to the patient, we have some patient improving. Then we recorded that management to apply another patient. So we can add some guidelines from WHO, some guidelines from the Minister of Health, and the clinical practice management. That improving a second wave of the COVID-19 will have able or the capability to manage the new patient, and even the third wave is more familiar to manage with any case of the patient. When it comes to the patient in the hospital, most of the need the patient to have oxygen management and supportive management, and if patient develop heart super infection, have some guidelines for. I believe that ideas from the links from the international is more important for us because we are increasing the capacity management of the King catchment. And also King's College and would more appreciate the triad system. Triad system is very important because we have located to sort the patient. If the patient is severe, mild, and the moderate, that we have aided the management of the COVID-19. I tell you, I'm thinking that the links aid from the international is good for us.
Thank you, Dr. Muhammad, Dr. Abdishakur. I think that's really appreciated, and working together is very important, as you said. Thank you very much. So I'm now asking Mahmoud. Mahmoud, if you were supposed to draw a lessons of the last 2 years and a half, what lessons have you learned, and what recommendations you can share?
The draw lessons in the last 2 years are more experience because of working in the critical patients, and in the and working in the COVID patients. I have a more experience.
Okay, so you got an experience of the last 2 years. That's the lessons that you have learned.
The learning in the how to manage in the BC in how to use in the BCR machine and in how to survive in how to in monitoring in the critical patients in oxygen in, and how to support to patients with low oxygen.
Yeah, thank you very much, Mahmoud. Can I ask Mustafa, Dr. Mustafa, as a manager of Hargeisa Group Hospital, what lessons you can draw from the past 2 years and a half, and what recommendations you can share?
The past 2 years was, as I mentioned, very tough. So we have learned a lot of things. So the lessons that I have learned are, for example, the importance of establishing, epidemic preparedness and emergency preparedness and epidemic preparedness, and the effectiveness of coordination when it comes to outbreak management. So, when the outbreak when the pandemic has started, so as I tell you, we have established multiple layered structures for coordination purposes. So the importance of coordination and also the importance of resource mobilization. So there was a lot of resource mobilization that we have done, PPEs, and other, essential equipment to treat and counter COVID-19, and also the importance of sharing information to the public. So when the COVID-19 case has started, the government has started programs to share the public updates about COVID-19. So instructions of they should wear masks if they are going out, the 2 meter distance, self-isolation. All of that information has worked well in the public. So when you go out to the Hargeisa market, at that time, you were seeing most of the people are wearing face masks, and also self-distancing was also implemented. And the other issue that I would like to highlight is the issue about mental health. So it was a very tough 2 years. So that 2 years has caused a lot of mental health problems. And I think still the issue of mental health is not, addressed appropriately. So that's yeah.
Yeah, so could you say the last one? Mental health issue was not addressed. Is that what you have said?
Yeah, I have said mental health issues were not addressed appropriately. Yeah.
Yeah, thank you very much. I think you have drawn a lot of lessons that you have learned as the Hargeisa Group Hospital. And I think coordination, resource mobilization, and setting up an emergency unit is very important to respond to COVID-19. And I think if any other emergency comes in, I think now you are prepared so that you can able to respond. So thank you very much. Dr. Abdishakur, I'm going to ask you the same question. As a medical doctor, what lessons you have learned from past 2 years and a half, and what recommendations you want to share with us?
Okay, and thank you very much. We have learned a lot of things, especially when the outbreak is when the outbreak is declared, the number of the patients that comes to the hospital. First is the confusion the nursing and doctors and the hospital staffs, because there is no half planning to manage outbreak management. Because I will tell you some historic, the emergency, the emergency department, the area comes to all the patients of COVID-19 is here. The emergency department comes to the 2 benches like trauma patient and COVID patient. That's more difficult to manage and to separate these patients. And we have learned a lot of problems, like we have lost our families and more friends because there is no have management plan, the outbreak management. So that for the last 2 years, we have got or learning a lot of problem, and especially like how to manage outbreak management or the like highly contagious infections like this COVID-19. That's one point. I would like the recommendation, in especially Hargeisa Group Hospital. We have challenged or faced many obstacles when I went during the COVID-19 time. First, I would like to recommend the number of the points that I would like to add this conference. First, we like to establish the disaster management team, number one, and also we have outbreak management plan if the COVID-19 and other conditions, and also we have more important the call center available. Any patients and any problems when they're coming to the patient to the hospital, they calling him first, then they prepare. And also equipped ambulance. We have ambulance, but we have not standard in the in the worldwide. Also equipped ambulance and also well trained in the nursing and hospital and doctors, and also some kit of the BBE and also isolation ward is very important. When the outbreak is coming and the number of the highly contagious diseases coming to the hospital, there is no separately. The patient is normal patients visit in the daily in the hospital and the COVID-19 patients. Isolation ward is especially anytime we need to use when the outbreak is declared. And also the main important is ICU, because when the patient to the hospital and admitted, first we start the oxygen. If the oxygen is not available and the patient develop respiratory failure, we need ICU to use ventilators. We don't have ICU specialists. We don't have the ICU equipment also well equipped. So we have to prepare the ICUs and also ventilators or respiratory IDs. And finally, if the patient recovery to the discharge to the hospital, they impact psychological impact. We need psychotherapy and psychosocial center is very important. So to monitor and develop our patients. This is my lastly recommendation. And also we have got a lot of learning. Now we are ready. Any outbreak if coming to manage and to at least 50% to work in that outbreak.
Yeah, thank you very much. I think that was very important lessons that have been learned for the last 2 years and a half, and I think good recommendations that came out. And I hope we may not have another pandemic, but in case it came, I hope that we
also
ready.
we use everything, any pandemic. This is like another conditions. We have used these recommendations.
Excellent, thank you very much. I think we passed a very tough 2 years, and we lost a very important people like Dr. Diri, Allah yarhamu.
Yeah, yes.
The Dean of Hargeisa University Health Science. We lost very important people for during the pandemic.
Also, I am his doctor. I am his doctor for the area for the last when the time of the admission to the hospital until the last the area.
You were treating Dr. Diri.
Yes,
I can imagine the stress you were feeling during that time.
Yeah.
So thank you very much for joining, and I think the lessons that you have drawn and the recommendations were very important. Thank you very much for joining this session, and I hope I could say thank you very much, and I appreciate your time having with us today. Thank you very much.
Thank you very much, Laura.
Thank you very much.
Thank you very much.